Hello, Chris Godinez, licensed professional counselor, also the co-host of We Need to Talk with Chris Godinez. So this video is for educational and informational purposes only. If you feel you need a therapist, please go to Google, type in therapy your city, psychology today will pop up, and it will have all of the therapists in your area. Okay, so today's topic is how to find a, it's not working, okay. 3. Okay, yes. Okay, today's topic is how to find a therapist. So let's see, what do I want to talk about? So first of all, I need to let you know I am on the road, and I am in Boise, Idaho right now, and it is freezing cold. So anyway, and I'm going to be catching a flight, so this is going to be kind of a short one today. So how to find a therapist. So let me tell you about some of the things that I have been getting online. A lot of people have been telling me that that finding a therapist is really difficult. So that therapists don't believe them, that it is really hard to find a therapist that understands that there is abuse going on or that there is violence going on. And some of the stories I've been hearing from you guys I find really shocking and horrible, but not unbelievable, because it's like I said. Okay, so hi, Steph. So in my profession, okay, they do not train therapists to do personality disorders, and very few therapists get training in domestic violence, which to me is just mind-blowingly stupid, if you want my personal opinion. Hey, Arthur, thank you. I like the scarf too. Thank you. So how can you schedule an appointment with me? Okay, if you are in Arizona, okay, well, that's a good thing. I might as well address that. If you are in Arizona, I can only counsel people that are in the state of Arizona because of licensure. So there is licensure in all 50 states. Okay, we finally got licensure in all 50 states. So you can only see the person that's in that state. So you have to be a resident of the state of Arizona, and I like to do face-to-face appointments. Some people are like, oh, I'd like to do phone call appointments. I don't like to do phone call appointments. I like to see the person because I look at their body language, I look at what they're saying and how they're saying it, and it makes it a lot easier to do therapy that way. So if you want to schedule an appointment with me, you can go over to my AHA Counseling website page. You can contact me through the email there, or you can just give me a call on my business phone, which is 480-772-2561, and that's another way to get a hold of me. Usually it's best to call because I'll answer the phone immediately. The email, it takes me a couple of days to get to. So anyway, that's it. Hi, Maria. Okay, so let's talk about therapy and therapists and why it's so hard to find a good therapist. So when I was going through school, and this was in 2004, 2005, they did not train people in personality disorders at all. Period. They just didn't. It was not even touched upon. And in fact, one of our professors said, yeah, the APA, the ACA, they're having arguments over it, and they say it's a personal choice, yada, yada, yada. No, it is not a personal choice. It is a disorder. And they didn't want to touch it because it was a political hot potato at the time. And this was back in 2005. So there is a whole group of people that went through their master's degree and did not get the proper training in personality disorders or domestic violence. So you want to find a therapist if you have been the target of abuse, whether it was from a malignant borderline or a malignant narcissist or any kind of abuse. You want to find a therapist that specializes in DV, like really truly specializes in DV, domestic violence. Hey, Debbie. Hey, Shannon. So, okay, so here's the thing. So I've had people say, but they said they specialized in domestic violence, and then said something along the lines of, oh, he or she was just kidding when they held the knife to your throat. I'm sorry, what? Who? What? Can we? What? Yeah, no, I'm sorry. If somebody's holding a knife to your throat, that's not kidding. That's you don't do that to people. So, so basically, you want to find somebody who is skilled in domestic violence, who understands borderline personality disorder, malignant, who understands narcissistic abuse, narcissistic malignant personality disorder. And you need to find somebody who knows what they're doing. So you need to ask as many questions of them as they ask of you. Hang on just a second. So many abuse victims want to mediate for new praise and flying monkeys, such as warning them. Okay. We'll talk about that. Remind me about that, Tricia. I want to hit back on that. So, okay. So when you're looking for a therapist, and I've heard this from multiple people on this website, on my website, on other abuse forums, Oftentimes you will find very, very bad therapists, and sometimes they themselves will be abusers. And I wanted to give you guys a story to illustrate why you need to interview the therapist as much as they interview you. When I was going through school, not only did they not teach the cluster Bs, they basically ignored the entire Axis 2 thing, which is the cluster Bs, cluster A, cluster B, cluster C. They ignored that and then said, oh, no, 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 you don't need to know that. Oh, no, 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 they're going to get rid of it. No, you know, no, no, no. And the reason they said that is because of the political BS that's going on, the fact that it's a political hot potato, the fact that half the APA and half the ACA would love to get rid of personality disorders and just pretend they don't exist. And here's the reason why. The half that wants to get rid of them probably have them. Sad truth. I know people aren't going to like that. Oh, well. So, and let me illustrate to you why I believe that that is the case and why other therapists believe that is the case. When I was going through my schooling, we had several people in our group, you know, because we had like a group of like 30 women that were going through, maybe a few men in there as well. And of that group, there were at least 2 that definitely showed strong traits of a personality disorder. And in fact, one of them had said, oh, well, I'm getting my master's degree and I'm becoming a therapist so I can figure myself out. I'm sorry, does anybody else see the problem with that? Because no, with a side of no and an extra helping of no. You become a therapist because you've done your own work, you realize who and what you are, you know your strengths, you know your weaknesses, and you know exactly what you can do to help people. So for me, it's once I did my own therapy, because I told you I sat on a couch for, you know, laid on a couch for 7 years and worked on the relationships, you know, issues with my mom, my dad, the original wounds, all of that stuff. And at some point towards the end, I went, wow, I've been through so much. I have all of this experience. I can turn around and help other people because I've got my own stuff nailed down tight. So I can turn around and help other people. People that go into therapy to figure themselves out are the worst therapists because they haven't figured themselves out yet. They're not learning to go, how can I help this client? How can I help that client? What do I need to know to help this person push them up to the next level? No, they're doing it to figure themselves out. That's a completely selfish reason to get into therapy. That is a completely selfish reason to turn around and supposedly help people because you're not. Because you're relating everything back to yourself. You cannot. That's called transference and countertransference. That's when you start relating to the client because they've got the same issues that you have. You've got to nail that shit down before you become a therapist so that there isn't transference and countertransference. Is there always going to be a little bit? Sometimes. Sometimes a person will walk in and you'll be like, wow, I really relate to that. But you recognize it and you work on it. A bad therapist? No. They absorb it and they become it. And it's just, don't get me started. Okay. So bad therapists do that. They get into therapy to figure themselves out. The other thing that they will do is that there is no regulation on Psychology Today as far as what you can put as your specialties. You just click boxes saying what your specialties are. You're relying on the therapist to be honest and say what their specialty is, which is why you've got to ask as many questions as you possibly can. So you want to ask things like, well, first of all, you want to try to find one that does specialize in domestic violence. So when they say they specialize, what's their background? How much experience do they have in this? How long have they been a therapist? What drew them to working with domestic violence? Who do they advocate for? Are they there to help fix the perpetrators or are they there to help the targets of abuse? Those are huge questions to ask because therapists do different things. So like for me, I advocate for the abuse victims, the abuse targets. That's who I advocate for because they don't have a voice. Other therapists out there advocate for the perpetrators, and that's okay. That's their thing. As long as they're honest about it and that's what they're doing, great. But you need to be clear in who you're advocating for. For me, I advocate for the targets of abuse. You're damn straight. Other people out there work with the perpetrators, and you need to ask that because not all DV therapists are the same. Some advocate for the perpetrators, some advocate for the abuse victims or targets. So you need to ask a bunch of questions. How long have you been doing this? Why are you doing this? Where did you get your training in? Have you worked in a domestic violence shelter? What's your modality? And this is something else that people don't understand. Therapists all have different modalities. There's different theories that you pull from. Some of us are eclectic, which is what I do. I pull from everything depending on what the client needs. I had one client that they needed the Freudian psychoanalytical, thing. And so I went with the Freudian psychoanalytical thing, even though I'm not a huge fan of Freud. I don't like Freud. I think Freud's a freaking asshole. But there's things in Freud that are really helpful. Right. My therapist told me to go back to his house to get closure. Sweet baby Jesus. After I finally fled from the narc, when he started texting me horrible things like, don't make me throw your stuff out, I'm changing the locks, my therapist said that it was my fault, victim blaming, because I had hurt him by disappearing on him, and that he was being reasonable by offering to let me get my stuff. I said, I believe what you're saying, but I'm not sure it's true. And he's just so hurt. Yeah, no, it's never your fault. Normal, healthy people don't threaten to do that. They don't. They just don't. Thank you so much for the show, Chris. It's vital that we detect if they're either not prepared or disordered themselves. Good point. So like I said, I went through school with at least 2 people that I believe firmly were disordered. Absolutely. And they were there for the wrong goddamn reasons. And there's a lot of therapists out there like that. They get into it to figure themselves out. Wrong. You figure yourself out first, then you help. It concerns me when an abusive sociopath I went no contact with 4 years ago is about to complete his major in psychology. And I know of a psychopath who taught algebra, who's just about to enroll as well. God help us all. Yeah. You need to really look to see why they're doing this. What's the payoff? Are they doing it to truly help because they've been there, done that, and they know they can help other people, or are they doing it to, figure themselves out and or control and manipulate? Yeah, you've got to be really, really careful about that. Plus, trying to help can put the victim in danger. Yeah. So, yeah, you got to know what you're doing. That's the thing. You've got to understand narcissistic abuse. You have to understand psychopaths. You have to understand how these people think so that you can help the target of abuse find their way through the maze and get out safe on the other end. Absolutely. Why do schools let people in who are just there to work on themselves? Oh, girl, I'll tell you what. I got some theories on that. Here we go. Boom shakalaka. The school I went to was a private one. So it was a for-profit. So it had a group of investors that needed to have a payoff, and I honestly think that they took damn near anybody who had a high school diploma, a bachelor's degree, in a heartbeat, if you want my personal opinion. Did I get a good education? Yeah, I think I did, because a lot of my professors were really amazing, and they were in private practice, all except for that one I think I told you guys about, and this is what I want to talk about as well. So I had a professor one time at this school that made it loud and clear that he hated his clients, hated them, hated private practice, hated his clients, would much rather be teaching. Danger, Will Robinson. Those are the ones you want to stay away from. I got nothing out of this guy. He was the worst professor ever because he had absolutely no empathy. He was probably narcissistic, would be my guess. And he hated his clients. It's like he saw them as less than perfect and him as somehow this god on a mountaintop, and how dare they not, hang on his every word kind of thing. And those are the ones you want to watch for. It's like, look, guys, I am giving you as much information as I possibly can. Here's my thing. Listen, but verify. Listen, but verify. So anything I say, listen to it, but go verify it. Figure it out for yourselves. Realize that I'm telling you the truth. Go verify. Listen, but verify. It's do it. Don't just believe what I'm saying. Listen and verify. So there's that. They let them in because they need a payoff. The shareholders need a payoff, and they'll take anybody in. And there were so many times we all complained about this one person, and we were like, this person has no business being in our profession. Get this person out of here. They wouldn't do it. They absolutely wouldn't do it. Well, we're limiting this person to only working in a school setting. Oh, great. So she's going to be a school counselor. You're going to turn this loose on a group of children. Brilliant. Yeah, no. I mean, do you see where I'm going with that? So, yeah. My ex-stepdad was a 4th grade school teacher and had a degree from Michigan State. He knew what he was doing to me. Absolutely they do. Absolutely they do. They are not innocent in this. Abusers know absolutely what they are doing. You bet your sweet baby. Okay, degree in child psychology. Yeah, no, not surprising. I am not surprised in the least. So you want to ask a bunch of questions. You need to find out why they're doing it, how long have they been doing it, what's their expertise, what drove them to specialize in this particular field. I mean, for me, it was obviously family. Hello, Cuckoo for Cocoa Puffs. If you read my first book, which was What's Wrong with Your Dad, which was all about growing up in a family that had BPD, strong traits of narcissism and addiction. Yay. So that spurred me to figure myself out first. And then once I figured myself out, I went, holy shit, I can help other people. So that's great. So yeah, so you want to find out why they're doing it. Then the next thing you need to ask is the different modalities. That's what I started to talk about. So therapists have different modalities. The ideal therapist is one that can pull from whatever modality they need to. So like, you know, you can pull from Jungian, you can pull from Freudian, you can pull from Adler, you can pull from family systems, you can pull from reality therapy, you can pull from, there's all these different modalities. So ask people what their modality is. And you want to check out what the different modalities are. It's really not that hard to do. All you got to do is go to Google and you type in modalities for therapy, for psychology, boom, and boom, it'll pull up treatment modalities. There you go. And it just shows you the different types of modalities that there are. And it's different for everything. There's a different modality that you use for individual as opposed to group. There's a different modality that you use for family as opposed to individual. There's a different modality that you use for couples counseling as opposed to individual. Do you see where I'm going with this? So you want to make sure that your therapist knows what they are doing and that their particular modality is going to work with your personality. So I like Adler and I like Jung. I hate Freud. You know, it's different modalities work differently for different people, and you got to find the one that works best for you. And that's why I'm saying go investigate it before you decide to go to therapy so you have an idea of which modality you're going to relate to the best, if that makes any sort of sense. Trying to heal after a 7-year relationship, he discarded and devalued me, but first found the next supply. Yeah, that's what they do. He married her after 7 months. He does not give me back my cat. I moved to another town and left my job. It's been a hell year for me trying to educate on my own. Cannot afford a therapist. Greetings from Greece. Okay. Love you too, sweetie. Hang in there. I'm sorry about the kitty cat. That sucks. So if you cannot afford a therapist, and I know Greece is different, so here's some options that might work well for you. And I don't know about Greece. I've never been there. I'd love to. But in the States, if you can find a university or a college that has the master degree program for psychology, they will have a practicum. And that means that they need people to practice on. So their master level students who are being supervised by a professor will be able to do therapy for probably, I think it's a 6 to 8 week session, depending on the semester. And so you get free therapy for 6 to 8 weeks. So contact your local university, find out if they have a practicum for the psychology department or if they need people for the master's level graduates or you know, program to practice on, and you can get some free psychology that way. The other way to do it is to contact agencies like I know Catholic Charities and Jewish Family Services both have a domestic violence program. Those programs specifically offer free counseling to targets of domestic violence. So when you call them up, you want to ask for, you know, do you have free counseling for victims of domestic violence? And that's what you're going to, I hate the term victim, but that's what they'll understand. So, so you want to see if you can get into their free program. The other thing you can do too is that both of those agencies, Catholic Family Services, no, Catholic Charities and Jewish Family Services also have support groups. They have a list of support groups you can go to. If you cannot get to a therapist, support groups generally are free. Now, I do not know if they are led by a professional counselor or not, but sometimes just being able to go to a support group and have that support and be able to talk out what's happened to you and hear that you're not alone, sometimes that's enough to get you going, especially if you're having to do things on your own. The other thing I would suggest is if you cannot get to a therapist, read as many self-help books as you possibly can. You want to read the Self-Esteem Workbook by Schiraldi. You want to start working on Ptsd, Surviving to Thriving by Pete Walker. You want to get The Disease to Please by Harriette. You may want to read either The Object of My Affection is in My Reflection, Coping with a Narcissist by Raquel Lerner, if your abuser was a narcissist, or you may want to read Stop Walking on Eggshells, both the book and the workbook by Randy Krieger, if the abuser was borderline personality disorder. So those will start helping you. The most important thing is that you realize you're not alone. And sometimes if you can't get to a therapist, another good thing, another good resource is to go to websites like Flying Monkeys, and they've got resources on there. They've got wonderful articles. The other one is outofthefog.net, no, .website. outofthefog.website that's got a whole forum on there that, you know, can hook you up with support groups and can hook you up with articles that'll help, that kind of thing. So there's ways to get around not having a therapist. If you are, yeah, I love Jung. So you wanna look up the different counseling modalities to see what works for you. For me personally, in my own personal therapy, because I do see a therapist. So, and this is something, this is something else I want to make very clear. If you are seeing a therapist, ask them if they have their own therapist. Are they still doing their own work? Because here's the thing, you need to stay clear as a therapist, because stuff will come up in therapy or stuff will come up in life, and you don't want to drag that into the therapy session. You need to be crystal clear when you're going into work with somebody. You have got to have your own stuff nailed down. I have my own therapist. I always have. I work on myself, and you know, and especially, you know, and there have been periods where I went without therapy, but I also had and have a whole group of other therapists that we all consult with to staff cases. So you want to ask them things like that. It's like, who do you staff your cases with? How often do you staff your cases? Do you have somebody that you can go to and ask questions if you don't have the answer? Because, you know, not every time am I going to have the answer. I mean, either I'm going to need to go and research stuff, or sometimes with a client, I'll just get stuck and I'll have to go to a different therapist and say, okay, I'm going to staff this case with you. Here's what's going on, you know, not giving any details, but, you know, here's what's going on generally. Here's where we're getting stuck. What do you suggest? And oftentimes the therapist will be like, oh, well, have you tried this? And have you tried this modality? And have you tried this thought? And have you tried, you know, this intervention, this kind of thing. And it's good to have different therapists to bounce off of. If you've got a therapist who is what's the word I'm looking for? A lone wolf and thinks they know it all, and doesn't staff cases and doesn't have their own therapy, and then run in the opposite direction. You betcha. Because you need to have somebody who's got the self-esteem enough and the humility enough to know that you don't know it all. And if you don't know it all, you need to have a backup. You need to have people that are backing you up so that you can go to them and say, I'm stuck. Help me with this client, you know, staffing the cases, that kind of thing. Psychopath Free is a wonderful, wonderful book. Yes, that is a wonderful book. That's another good one. Yes, thank you. Okay, I went to community mental health counseling, and they said I was DID and said their MSW couldn't help me, and I had to go somewhere else. Insurance doesn't cover much. Can't be that damn rare. Well, so here's the thing. Dissociative identity disorder. A lot of counseling schools don't cover how to work with DID. They just don't. It's stupid. And insurance is worthless. It really is. It's like, and that's why I don't take insurance for so many different reasons. One reason I don't take insurance is because I like to work with military, firefighters, and police officers. And you don't want anybody knowing why you're going to see a mental health therapist on that one. But the other thing of it is, too, because it could ruin your career. Even if you're going for anxiety, even if you're going for PTSD, it could potentially ruin your career depending on how unscrupulous your, you know, particular work environment is. So, so I don't take insurance for a couple of reasons. One is that I don't think it's anybody's business what your diagnosis is. And number two, I do it because I can then do flex rates. In other words, my normal fee is $100 an hour, but if somebody's having financial difficulty or if they are the target of financial abuse, I can come way down on that because I want to work with somebody. I would rather, I'm a damn socialist, I would rather they get the help than not get the help. So, and I kind of figure it all evens out in the end anyway. So, so you want to ask them, do they take insurance? What does their insurance cover? You know, it's like, will insurance cover marriage counseling? You'd be surprised the number of insurances that do not cover marriage counseling. You'd be surprised the number of insurances that do not cover dissociative identity disorder. It's amazing. It's amazing the way insurances weasel out of paying for things. So, so you want to ask what your fee schedule is. Can you work with me on the fee? Can you come down on the price? Can you, you know, things like that. And here's the thing. You want to be honest about it because it's like I tell people right on my Facebook page or on my website page, I'm like, look, if you're telling me you're in financial need and I give you a lower price, but then you start talking about your second home in Cabo or your yacht or whatever, I'm raising the price right back up because those prices are for people who need it. So those people, when I say financial, I mean you're not going to be able to make rent. You're not going to be able to feed yourself or the kids. You know, your nails are not done. Do you dig where I'm going with that? It's like if you're just looking for a free ride, screw that. noise. But if you really are financially in debt and need help, yeah, I'm willing to come down on the price. So there is that. So you want to ask these things of the therapist. It's like, you know, can you work with me? Can you do a sliding scale? If the therapist takes insurance, they cannot, because it is considered insurance fraud. How screwy is that? So even if the person is a private pay person, they have to pay whatever the going rate is that the insurances are paying. So let's say that the insurance offers the therapist $60 a session. The therapist then has to charge $60 a session, even for private pay people, which I think is stupid. It's stupid. To me, it's like, well, if somebody's got insurance, let the insurance pay. If somebody's only got cash, then I should be able to adjust the price. No, they consider that insurance fraud, which is so illogical. Okay. Yeah, Lori, don't feel bad. It's not every therapist is comfortable working with dissociative identity disorder. I think I want to make that very clear. And that's why you need to ask them. It's like, and you know, and here's the other thing. If they just said that the MSW couldn't help you, and they didn't give you referrals, that's called abandoning a client, and you cannot do that, and that's illegal, and you can actually call the state board and file a complaint about that. Absolutely. Because anytime you have to stop therapy with a client, you always give them referrals, and you always document it. It's like, okay, contacted the client, gave the referral, contacted the client again, you know, gave a different referral. You know, you do it at least 3 times to make sure that they've got all of the stuff that they need and that they're not just being abandoned. That's abandoning the client. If they just said, oh, well, I can't do DID and I don't want to touch that with a 25-foot pole, here you go, good luck and on your own. They've got to give referrals. They've got to give referrals. And if they didn't, that's called abandoning a client. And that is ethically against the ACA Code of Ethics. Don't feel bad, Lori. There's a lot of people out there that have dissociative identity disorder. It comes with CPTSD. It does. So it may actually be rooted more in CPTSD than actual DID. And that takes somebody who knows what they're doing to differentiate between the two, because people with PTSD and CPTSD often disassociate. So get with a good therapist and find one. Ask them a whole bunch of questions. Do you understand CPTSD? Do you understand disassociation when it's involved with CPTSD, et cetera, et cetera, et cetera. Okay. The covert narcissist always blame me for his coldness, cruelty, his withholding, lousy sex. Even though I write down what happened, I still get abuse amnesia, where I think that maybe he wasn't a narcissist. Maybe his love bombing phase was his real self. And it's just my fault for not being good enough, not doing enough to keep him being nice to me. No. He preyed on my fears of inadequacy. Yes, this is what they do. He was from a rich, snobby family, while I'm the petrified only child of a schizo-affected mother. I stopped being able to trust my perceptions. When my therapist refused to listen about the narcissistic abuse and clearly didn't understand what it was, and instead put the blame back on me, it was like she was telling me that everything the covert narc does was true. It was cognitive dissonance for the mental anguish. It was so bad, I was nearly suicidal. So here's the deal. Yes, no, it's not your fault. It's not your fault. So completely not your fault. Hold on, I need a sip of water. Oh, it's so dry here. Oh my gosh, it's been like 20 degrees. So not a northern girl. Okay, so not your fault. So here's the thing. Therapists have a really hard time understanding abuse. Healthy, normal people have a really hard time understanding abuse, okay? It's only when you've studied it and or been through it and studied it that you start wrapping your head around it. So in non-abusive therapy, the goal is to hold the client accountable, because a lot of clients have a tendency to do the whole, it's not my fault, not my fault, not my fault, not my fault, victim thing, right? So when you do that to somebody who really is a victim, who really has been abused, that puts shame onto the target of abuse. And a therapist who does not know what they're doing is going to inflict more damage, just like you said, that shame, that feeling suicidal because you felt like, I'm bad, I'm wrong, I'm remembering it wrong. No, you're not. That whole thing. So that's why I'm saying you've got to be very careful when you're dealing with therapists. You want to get one that gets that, yeah, people like that exist. Yeah, that abuse is out there. No, it wasn't the target's fault. We take responsibility for stuff that we should take responsibility for, but then the stuff that the other person did is not our fault. It is not our fault, okay? So like I said, in therapy where there is no abuse going on, you want to hold the client accountable, absolutely. But when you're dealing with somebody who has been targeted, who has been victimized, who has been harmed, verbally put down, physically harmed, etc., yeah, doing a typical normal quote-unquote session is going to do more damage. That's why I'm saying you've got to be really, really careful. No, trust your gut, my love. So it's funny you should mention this. So I'm here with the great nieces and nephews, right? I call them the gingers. And we were watching Frozen. And I'd never seen Frozen before. I kind of stopped watching Disney movies a few years back. And so I just recently watched the whole thing all the way through. And in Frozen, I don't know if you guys remember this or not, but you should watch it again, because a perfect description of narcissistic abuse and love bombing is when Prince Hans goes after Anna and starts, oh, you like ice skating? I like ice skating. You like bananas? I like bananas. You like this? I like this. Look, we love everything together. Mirroring, love bombing, right? And then as soon as he realized he could get what he wanted, because he had her, she loved him, she thought he was true love's first kiss, boom, mask fell off and he turned into a complete douchebag, right? Perfect example of love bombing, perfect example of a narcissistic relationship, a narcissistically abusive relationship with somebody who's an empath and young and naive and whatever. Do you see where I'm going with that? So yeah, they do love bomb. And so that is a mask. That was a total mask that Hans was wearing. That was not the real him. The real him was the one who walked into the room while she's dying and going, now I got what I want. Peace out, baby. You know what I'm saying? So that was who Hans really was. So trust your gut, my love. Trust your gut. It's like, was that love bombing real? Well, it was real in that he mirrored you. He mirrored you perfectly. It's like you fell in love with yourself. He was showing you who you are, really. That's what you fell in love with. That's the mind-blowing thing. It really is. And then when he had you, mask comes off, claws come out, bada bing, bada boom. Now you're hurt because it's like, what just happened? You know, I thought this person was one way, but now they're another. So that's the love bombing thing. So if you really want to see a good example of love bombing, watch Frozen. Watch Frozen. It's that whole Hans-Anna thing. That is a completely abusive relationship right there, from the love bombing to the discard. It's amazing. It blew my mind when I watched it. I was like, Disney is deeper than I thought it was. Wow. Anyway, so there's that. Okay, and yeah, your therapist was treating it as if it was a quote-unquote normal relationship. You can't. If there was abuse involved, absolutely. Trust what you know. Trust your perception. That's the biggest thing. Learning to trust again. And this is the hard part. It's like, I can teach you all of the skills. I can teach you all of the techniques. I can teach you everything. You have to do the work to learn to trust. I cannot teach that. I cannot teach trust. I can teach you how. I can teach you how to get there. But you've got to do the work to get back to trusting your gut. The head will steer you wrong. The heart will always steer you wrong. God love them both. But the gut will never steer you wrong. Listen to your gut. We've been trained to not listen to our gut. So listen to your gut. If your gut is telling you your therapist is off, then your therapist is off. Trust your perception. Nobody is an expert on you except you. That's what I want to get across. Because there's so many freaking therapists out there who act like they're some sort of freaking guru on top of a freaking mountain going, I know what's best for you. Oh my God. No, I don't know what's best for you. Freud doesn't know what's best for you. Jung doesn't know what's best for you. You know what's best for you. You take what works and you chuck the rest. Listen, but verify. Listen, but verify. Does that make sense? So yeah, and here's the thing. It's like when therapy is not working, I love it when clients speak up, because sometimes a client will come back to me and go, you know, when you said this, it just, it didn't feel right. And I'm like, okay, then you're right. Let's go with that. Let's see where this one leads. You listen to the client, you meet them at their level, and you follow them on the journey. And all you're doing is trying to guide them. You're not taking over their life. You're not the guru on top of the mountain. You're just guiding them. It's like you're the guide in the back of the raft when you're going down the rapids so that you don't hit rocks. That's basically all you're doing, is steering away from the rocks and keeping the path clear so that you can get to the final destination, which is mental health. So yeah, I see your frustration. I totally see your frustration. DID. DID is dissociative identity disorder. It's what occurs when we have had CPTSD or PTSD. We disassociate. In other words, that otherworldly feeling, we float out of our body. It's kind of not real. In extreme cases, it's when you adopt a different personality. That's also dissociative identity disorder. So oftentimes with abuse, and especially with children that have been abused, sexually abused, they will remember the event as if they were floating out of their body and watching it from the corner of the room. That's dissociative identity disorder, and it's a protective way. It's kind of like it's happening to you, but it's not happening to you, and it's a way to survive it. So that's dissociative identity disorder. My friend has DID and antisocial. Not sure how you treat that. Seems impossible, incredibly hard. Many with DID also have BPD too. Well, yes, because BPD, borderline personality disorder, is rooted in trauma. So not surprising that people with borderline personality disorder oftentimes also have DID, dissociative identity disorder, because they also have CPTSD, complex post-traumatic stress disorder. It's like, how many acronyms can we throw into one sentence? But yeah, it's true. So anytime you've got anywhere where you are disassociating, there is trauma involved in some way, shape, or form. Physical, verbal, mental, emotional, spiritual, religious, etc. I'm a MIL spouse, but military spouse. But TRICARE approved my therapy with no referral or anything almost instantly. It's been great. Oh, that's good. Okay, hi Chris. Scariest thing is to have a therapist that's a covert narcissist. Even worse if you're in a relationship with them and completely soul destroying. Yeah, okay. So I am immensely worried about any therapist that describes themselves as a self-aware narcissist. I think a few of you know who I'm talking about when I talk about that. Has some of the stuff that guy has done been interesting and enlightening? Yeah. Do I think there's an underlying motive? You bet. So yeah, it's like I said, again, oftentimes in my profession, you will find that narcissists are drawn to becoming therapists, psychologists, psychiatrists, etc., because of the power. It's a lot of power. With great power comes great responsibility. And that weighs on my mind every moment of every day, because I realize that what I say is going to affect people. Narcissists, on the other hand, don't care. So, and when they become therapists, they do a great deal of damage. So that's my concern. So yeah, you don't want to be in a relationship with them because they will manipulate like nobody's business. Abso-freaking-lutely. That's what they did, no referral. Lori, file a complaint with your board. Abso-freaking-lutely. File a complaint with your state board. Every state has got a board because we're all licensed. And basically, we can only practice in the state in which we are licensed in, and we have to adhere to a code of ethics. If you want to know what the code of ethics is, go to ACA, look up the ACA code of ethics. It'll print it out for you. And right there in one of those sections, it says you cannot abandon a client. You have to give referrals. Absolutely. Now, if the client abandons the therapist and the therapist has reached out multiple times trying to call them and contact them and there's no answer or whatever, that's different. That's not abandoning. That's the client not responding. And again, you document that. But if they just like said, oh my God, you're DID, I can't treat you, peace out, then yeah, that's abandoning. Don't put up with that. Go file a complaint. Abso-freaking-lutely. Hey, Marianne. I went through something similar. The first therapist I saw after ending an abusive relationship with a covert narc 5 years ago left me in a much worse state, and I felt was all my fault. So much so that I eventually fell for a sociopath. So again, thank you so much for doing this show. It's really, really important. Oh, thank you, Arthur, and I'm really sorry you had to go through that. See, that's the thing. It's like if you leave a therapist session feeling worse than when you came in, then Houston, you got a problem. Something's going wrong. Because the way I know that I'm doing things right is my clients are always like, oh my God, it feels so good when I leave. And I'm like, yes, keep it going, you know, that kind of thing. So you want to make sure that, you know, if you're with a therapist, that you feel better. Now, are there going to be times when you're working on stuff and you just leave that therapy session going because you've just been working on all of this stuff? Yeah, there's going to be days. But if the overall is that you're feeling good and you're feeling better and things are getting better, that's the thing. It's like scale of 1 to 10. Are you better, same, or worse? That's the question. Are you the better? Are you the same? Or are you worse? And that's what you always want to ask yourself after you've been going to therapy for a while. If you're better, great. If you're the same, why? What's not happening? And if you're worse, get out. Find a new therapist. Seriously. All right. Yeah, Frozen is the perfect example. I swear to God, I saw that movie and I was like, oh, he's a narcissist. Yeah, love bombing. Totally. I remember even turning to my little niece and going, that's love bombing. Watch out for that. So yeah. Okay. Though some positives, on the whole, my experience with therapy has been negative. I've been hurt deeply several times. Now that I've educated myself via YouTube, for example, I would not choose any of the therapists I saw again. Practice makes perfect. I know. It's kind of a hit and a miss thing, and that's what I hate about it, because it's like you don't want to get a bad therapist. Post-narcissistic abuse by mom, I'm having a difficult time between my gut and hypervigilance. Yes. I fear choosing a therapist. How do I protect myself from being fooled again? So again, it's just going to take practice and word of mouth. Oh, that's what I wanted to tell you guys. Word of mouth is really good. You cannot always believe online reviews, okay, because sometimes you get Looney Tunes that get on there and just post bad reviews just for the hell of it because they're trolls. But you want to talk to people. This is another reason why I like support groups. Who did you use for a therapist? Did you like them? What did you get out of it? Was it worth it? You know, would you recommend this person? Would you, you talk, you find out who other people use. You get word of mouth recommendations. And that's a really good way to do it because you know somebody else who's seen them, which is yet another reason why I like our community here. It's like if you guys have had good experiences with therapists in whatever area you're in, feel free to recommend them if they're good. Because it's like people need to know who to go to in the different states. I'm only in Arizona, so, I can recommend a few people in Arizona, but yeah, we need to know who's good and who's not. And if it's not a good review, be careful about that because I know people are getting like weird about suing and shit. So yeah, so just if there's somebody that's not good, you can say, I didn't have that great of an experience with them. Here's a better therapist, that kind of thing. Okay, confusing as hell if they're BPD and covert narcissism. Yes. Hey, Anna. I have a lot of lost time. That's disassociating, yeah. Z, I'm glad I could teach you something new. Yeah, DID saved my life. Yeah, it absolutely does. When we're abused and we're being abused and we float out of our body, that's the way we stay safe. That's the way we cope with it. That's how we deal with that intense physical, emotional, verbal, sexual drama, etc. Yeah, don't go to a narcissist for therapy. And I find it more with psychiatrists. Honestly, I've had a lot of people say, oh my God, I really hate that psychiatrist. They're really arrogant. They're really this. Find another one. There's plenty of psychiatrists out there. You don't have to be stuck going to the one that's a jerk. So find somebody that works. Oh yeah, Chris, when someone says they are a narc and publicly admit they are a liar and then post all sorts of information about the topic. Well, they already admitted they're a liar. How much information can we really think is true? Yeah, see, that's just it. And that's what concerns me. And I think you guys know what I'm talking about is when somebody says, oh, I'm a self-aware narcissist and now let me teach you everything about narcissism. No. Don't believe it. Don't believe the hype. Okay. Hey, Chris, I've spent a lot of time sourcing a good counselor. Taking your advice met many, dismissed most until this week. Gut feeling is amazing. Yes. She calls a narc, abuse. She said that our therapy is a journey. Yep. And she's taking with me and looks forward to meeting me at the other side. Feeling quite emotional. Gone no contact for a week now. Karen, you fucking rock. Good job. Good job. Go you. My therapist was awesome. He suggested I take a core belief schema. Good deal. Oh, schema therapy. That's another one. I don't do schema therapy, but some therapists do schema therapy, and schema therapy can be very helpful. So again, look it up, check into it, see if it works for you. If it appeals to you, go for schema therapy. Yeah, you betcha. Now I know exactly what I want to work on. Good job. Good job. Good job. I got out of an abusive relationship 25 years ago. I had no idea what had happened to me, but I knew I needed counseling. I went through my general practitioner and was contracted for 6 sessions. Counselor didn't get it at all and booted me out the door after the second session. Put me off the train again. This is in the UK. I cannot tell you guys the number of you guys from the UK that are telling me that the social services over there sucks. So like, yeah, it's really, hey Beth, it's really hard to find good therapists apparently in the UK, but they're out there. There's good therapists everywhere. You just have to dig for them, seriously. And don't be put off by it. You have a bad experience, you dust yourself off, you go, well, shit, that didn't work, and you go find a good one, basically. And eventually you will find one. So trust your gut, trust your gut, trust your gut. Hypervigilance, trusting your gut. So the hypervigilance is a panicked feeling. The gut feeling is a really calm feeling. It's kind of like a, no. Or a, yeah. It's like that. It's not that panicked, oh my God, are they good? Are they bad? Are they good? Are they bad? Are they good? Are they bad? It's kind of like a, what do you feel? Yeah, they're good. No, they're not. You know, it's not a panicked feeling. So trust the gut. The gut is a much more calm feeling than the head or the heart or the hypervigilance. So I have a few questions, but we'll PM them as I don't think I should ask them publicly. Okay. Besides, I'm not at home. I actually drove 50 miles to go shopping, and it didn't take me 4 hours to talk to myself into it this time. Oh my God, Cynthia, that's awesome. Good job. Good on you, girl. You keep going. That's awesome. Yeah, PM me. So if you guys have got questions, and please remember I've got a full-time practice, so it may take me a few days, occasionally a week or more to get to the questions. But if you have questions that you don't feel comfortable asking here on either the Facebook or on YouTube, because you can ask them on YouTube as well, you can private message me on YouTube. You can private message me on We Need to Talk with Chris Godinez. You can private message me on Chris Godinez LPC, or you can private message me on the AHA Counseling page. So yeah, and just remember, like I said, I've got a full-time job besides doing this, so I will try to get to them as quickly as I possibly can. That might take me a few days, possibly a week, so because I try to keep up on everything. Okay, Cynthia, I'm so proud of you. Good job. Keep going. Yeah, PM me. That's fine. Even more confusing when they are diagnosed NPD, histrionic, HPD, and ASPD, which is antisocial. 16 years, hot mess, left in January. My mother is also a narcissist. Shoot me. I'm no contact with my mother and my ex. Oh, good, Grace. Good on you. Good on you. Stay no contact. You get out, stay out. Move forward. Go ahead. Get away. Go live your life. Go be happy. Seriously. I've been told by my therapist I'm bipolar 2 and borderline by my psychiatrist. However, they both have alluded my ex, who is the reason for my therapy, is a narcissociopath. This has caused me to revert back to self-blame. It's confusing because am I avoiding responsibility for my actions, or are these two professionals just trying to label? I see no bipolar at all. So BPD can mimic bipolar. And there's different types of bipolar. There's bipolar 1, 2, 3, 4, and on, I believe. So, you know, if the bipolar doesn't seem to fit, then read up on BPD. Does that fit? And if that does fit, then read up on CPTSD and see what the trauma is. Don't blame yourself. Stop. That doesn't help. It doesn't help. Stop blaming yourself. It doesn't help. Responsibility for our actions, yes. Blame, no. Doesn't help to blame, because all we're going to do is add to more shame, and you don't need more shame. You've got enough shame. Don't do it. Don't do it. So look up BPD, read up on BPD, see if that fits. If it does, there's a great book called The Borderline Survival Guide by Chapman and Gratz, and it's a really, really good book for people that have been diagnosed with borderline personality disorder. I also strongly suggest that if you have been diagnosed with borderline personality disorder, to read up on complex post-traumatic stress disorder, because that's generally where BPD comes from. So it's all based in trauma. It's all based in trauma. Don't self-blame. Get out of that. Take responsibility for your actions, but then forgive yourself and move forward. That is the most important thing. And when I say forgive yourself, I mean work on the maladaptive behavior so that it never happens again, right? And then work on compassion, self-compassion, self-forgiveness. It's like, okay, you work on those behaviors so that you don't harm anybody ever again. You don't harm yourself. You don't harm anybody else. And then you forgive. You forgive yourself. You have compassion for yourself. You do the Tonglen meditation, which is going somewhere beautiful. Imagining someplace beautiful in your mind. Sun is shining, birds are singing, not like Boise where it's freezing cold and no sunshine. Did I mention that? And you say something, you do the Tonglen meditation. You say something like this: may I have peace. May I have freedom from suffering. May I have all that I need. Food, shelter, companionship. May I have peace. And that starts working on the compassion for yourself. Eventually, at some point, you move on to somebody neutral, wish them the same thing, and then you move on to whoever you really don't like, your enemy. Wish them the same thing. So it's all about compassion and self-love. Absolutely. Self-esteem workbook would be another good one by Schiraldi. Okay. The narcs can deal with doing therapy to other narcs. Yeah, no kidding. Are there support groups in Phoenix? I'm a resident and I feel isolated. Yes, there are a ton of support groups in Phoenix. And if you go on to, oh Lord, either Meetup or, oh, dear heavens, I think we have cousins coming over. If you go over to Meetup, or somebody's at the door. If you go over to Meetup or you look up abuse support groups, there should be a whole list of support groups. You can also call Catholic Charities and ask them for a list of support groups, or you can call Jewish Family Services and ask them for a list of support groups for abuse. So that is something to think about. Okay. Let's see. I am seeing many survivors wishing to save, rescues other. Okay, so when we get involved in abuse, there's generally codependency going on because we want to save that person. We want to fix the abuser. And it generally comes from our childhood somehow. So for me, my dad, I desperately wanted to save my dad. I desperately wanted my dad to figure it out. So, but he couldn't, and he didn't, and he wouldn't, and he died. So there it is. So we often have a little bit of codependency going on. And so you have to nail down the codependency so that you don't give and 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 give to the point where you just go ka-thunk and keel over. So it's fine to want to help other people. It's great as long as you are not harming yourself in the process, as long as you are not giving to the point where you are just giving, 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 and then ka-thunk and keeling over. That's not what you want. Yeah, get a second opinion. If you don't like the bipolar diagnosis, get a second opinion, or read up on it yourself and see whether any of these labels fit. They may or may not. Again, listen but verify. Listen but verify. Super important. Okay. Hey, Georgina. Okay, daydreaming. Oh, this is interesting. I just posted an article on my AHA counseling page about daughters who were raised by malignant narcissists, abusive moms, and how we have a tendency to get caught up in a fantasy land or caught up in a fantasy world. Magic thinking, magic thinking, magic thinking. It was a really interesting article. It basically said that statistically, the children who were raised by abusive parents have a greater imagination because that's where we escaped to. That's how we stayed safe. It's a little bit of disassociation, but not really. It's more the magic thinking. So in order to stop the magic thinking, it's kind of important to do reality therapy. That is a thing. So reality therapy is, you know, what's real? What's really happening? What is in this moment real? What is real? What is not? So yeah, it is a thing. And a lot of children that were raised by malignant narcissists and malignant borderlines do have that maladaptive, you know, magic thinking, daydreaming kind of thing. And it's a way to escape reality because the reality is so painful. So it's a matter of confronting that original wound. It's a matter of confronting the pain and being okay with it. It's like you're going to walk through it. You're going to get to the other side. There's an other side to this. You're going to be okay. You got to trust that. Again, I can't teach trust, but you got to trust that. You got to do the work. You got to work on yourself, work on that original wound. When it gets too painful, back off, but then go right back to it. Don't ever just back off and stay backed off. So, okay. The Psychology Today site, no therapist that defines themselves as treating CPTSD or narcissistic abuse syndrome. I suppose it's not on those lists because it's not in the DSM. Yes, exactly. The DSM is just a guidebook. It's based on the medical model. So originally when psychology got going, it was part of the medical model. So we had to have Axis 1, Axis 2, Axis 3, Axis 4, and Axis 5, which is a medical model axis. That's how they treat physical issues. So in the DSM, no, it does not cover everything. No, there is no narcissistic abuse syndrome, which there needs to be because it's the same symptoms no matter where you go, anywhere in the world. You know, yeah, there's a lot of stuff missing from the DSM. And remember, it's all political. So, yeah. So when I try to do up my little elevator speech, when I'm either doing it for my website or for, talking to people, it's like I let them know, yeah, I work with abuse survivors. I work with CPTSD. That's not in the DSM either. And there's starting to be a recognition that there is a real thing, such as complex post-traumatic stress disorder, which is slightly different from PTSD. Similar but different. So anyway, yeah. So is there a way to identify which therapists treat these aside from calling them and asking? Call them, ask. Call them and ask. Call them and ask. When in doubt, call. Always, because you want to make sure you're getting the right therapist. You want to make sure. And honestly, a good therapist will take the time to do that. I try to answer doesn't always happen within a 24-hour period, but I try to answer every single phone call I get. And I try to respond to every single email I get to let people know, yes, I work with this, no, I don't, so that they don't waste their time waiting for me to respond to them so that they can go find a therapist that does, if that makes any sort of sense. Like, for example, I don't like working with kids. I don't. I like working with adults. That's my thing. And oftentimes what I find is that when somebody tries to drag a kid into therapy, not all the time, but oftentimes they drag the kid into therapy with the idea of the kid's the problem, you need to fix the kids, when in fact it's the parents that's the problem. Do you see where I'm going with that? So I would rather deal with adults. I would rather deal with adults. And I tell people that point blank. It's like, they're like, do you work with 9-year-olds? Nope. I do not. Thank you. So, I mean, I can, if it's an extenuating circumstance and I know the parents and the parents are not batshimomo crazy, I will work with the younger ones on that case. But usually, yeah, if it's just a straight cold call, do you work with kids? No, I usually don't. So call and ask. Absolutely, call and ask. All right, I had an abusive mother, and I just had experienced a horrible potentially sociopathic ex who got engaged 6 months after a horrific discard. So this is common. They will, narcissist abusers will immediately hook up with somebody else, immediately get a new supply, and immediately get married or have somebody move in or whatever. That's just what they do because that's what they do. Again, see Frozen. Good movie. Really good movie. Really enjoyed it. Liked Moana a little bit better, but Frozen was really good. Because hey, oh my God, hey, swear to God, it's like I woke up here in Boise and I'm like looking outside at all the frost and I felt like hey on the ocean. I was like, ah! Yeah, anyway. Okay. Thank you, Susan. I appreciate that. Who wrote the article? It's on Psychology Today. It's a Psychology Today article. It's on my AHA Counseling. It's one of the last ones I posted this morning, so it should be fairly high on the list. Okay. All right. Had that problem too. Used to stare out the window and wish that my life would be like, or what we wanted. Yeah, because we couldn't handle being abused. Yeah, it's the magic thinking. It's what we do to survive. And it only becomes maladaptive when it starts interfering with our regular life, when we cannot differentiate between the daydream and reality, and we'd rather live in the daydream than in reality, and we stop doing stuff for ourselves in reality, then it becomes a problem. Yeah, very often abused children have the best imaginations. We just do, because we needed to get out of it. The DSM is not complete. It's always being developed. It's not perfect, neither is the ICD-10. Absolutely. And like I said, you guys, they are going to review the DSM in 2018, something like that. And again, it's going to be a fight to keep the personality disorders in. And I honestly think that everybody should start writing and telling the APA and the ACA to keep in the cluster ABCs and to not get rid of the personality disorders, and that they need to include abuse survivor syndrome because it's real. So, okay, sometimes I get lost watching TV. I couldn't tell you what I just watched. I rewatch a lot of shows a lot. I also walk around and forget what I was doing because I was overwhelmed. Yeah, forget where I am and when I'm driving and panic for 30 seconds until I realize it. Yeah, that's common. When you've just come out of an abusive relationship, that's really, really common. So again, mindfulness. It's going to be practicing mindfulness, breathing. Where are you in the present moment? What are you thinking? What are you feeling? Where are you? Et cetera, et cetera, et cetera. So that's that. Okay, he left less than 3 months later. He was married. He was married. Our son was only 4 months old. Yeah, absolutely, Michael. Absolutely, they do that. So yeah, magical thinking is just a way to escape, and it's a way to make reality more palatable, edible, something, so we can deal with it, kind of thing. So, okay, I am running out of time here, guys, because like I said, I got to catch a plane today, so this is going to be a short one, unfortunately. So basically, to recap, when you look for a therapist, try to find word of mouth. Find, if you're in a support group, ask around. Who did they go to? Who did they like? What did they get out of it? What modalities did they like? What modalities didn't they like? Go to Google. Look up psychology modalities. There's a whole bunch of different ones. There's reality therapy. There's Jungian. There's Freudian. There's Adlerian. There's family therapy. There's a whole bunch of them. Anyway, there's a whole bunch of them. So look them all up. And schema therapy. Schema therapy is another one. So look them up. See which one resonates with you. Find somebody that does that. So, you know, for me personally, I liked finding a therapist who was Jungian and Buddhist, because that's kind of my thing. So, and she was immensely helpful. And I see a different therapist now, but she is also immensely helpful. And it's like, you know, you find the therapist that works for you. You find the modality that works for you. You ask the therapist, are they doing their own work? Do they have somebody they can talk to? Do they have a group of people that they staff cases with? How often do they staff cases? You know, you want to make sure that they're getting an outside opinion and they're just not lone wolfing it. So you want to make sure what their modality is. You want to make sure what their, you know, what their religious preference even is, because sometimes it's not going to work. So like, for example, if I went to a hardcore Christian counselor, that would not go with me because I'm, you know, Buddhist. So do you see where I'm going with that? It's like you find the therapist that is going to mesh with you well, that's going to be supportive, that you will relate to, because the relating is the biggest thing. It's like, honest to God, most of the therapeutic relationship is really just making sure the two of you are simpatico. You're meshing, you're doing well, you understand each other, and you've got this relationship going back and forth so that the therapy can happen. And that's where a lot of the work happens, is in that. So you want to ask a lot of questions. You want to ask how long they've been doing this. Why are they specializing in this? You know, what's their training in domestic violence? What's their training in CPTSD? What is their training in personality disorders? What do they know? How do you know they're a good one? So you want to do as much of that as you possibly can. Yeah, it's absolutely imperative that the personality disorders remain in the DSM. No, sweetie, you're not abnormal, Laura. You're not abnormal. It's what we do to stay safe. I mean, because when I was a kid, my family always was like, "Oh my God, you've got the most amazing imagination." Well, yeah, because I wanted to escape you nut jobs. Do you see where I'm going? So yeah, and honestly, you look at writers, you look at Charles Dickens, you look at, you know, writers like that, you look at their history, their family background. Usually, there's some sort of weirdness going on. That's why they have such an amazing imagination. So, yeah, parents and kids, but usually, so when I was talking about that I don't work with the kids, I work with adults. Oftentimes the parents that come in and do the whole it's the kid, they're usually personality disordered. They're not going to get help. They're not interested in changing. It's somebody else's fault and they want to blame the kid. Yeah, I only work out of Arizona. You're in New York City. So honestly, what I would do, there's a couple of therapists, well, there's a couple of life coaches that understand personality disorders. One of them is Rick Points. He is out of Iowa. He does Skype therapy sessions. It's not therapy, it's Skype life coaching sessions, but he understands the addiction involved in an abusive relationship. The other one is Lauren Archibek. She does NLP, but she prefers that be done face-to-face. So that's one of those ones where if you're going to work with her, you're going to need to fly out to Arizona to work with her, but she's amazing, and I freaking love that woman. I worship the ground she walks on. Okay, so, but Rick Points is really good. I've mentioned him several times. I posted his number on one of the videos that I did, but I can post it again when I put this up on YouTube. Okay, I'm glad I could help, Debbie. I'm glad I could help. Yeah, staff cases, not stack cases, yes. So you want to staff them with other therapists. In other words, you're taking your caseload to another therapist and talking over what you're doing. You know, am I on the right track? Is this a good thing to do? I usually do that only with the cases where I'm stuck, where it's just like, okay, I've had this person for 3 weeks now, and it's just, there's no moving forward. I don't know what I'm doing wrong. Is there another way I could approach this problem? What would you do? And you talk it through, and you figure out how this other therapist would do it, and then you take their suggestions and run back with it and see if it works. So staffing cases means you work through the cases and make sure that you're on track, basically. And that's what good therapists do. Hey, Sally. Okay. I think we got it. What modality is rewriting our narrative? That's working with a bad therapist. So here's the thing. You change, how do I explain this? So there's a difference between rewriting our narrative and rewriting our history, okay? So oftentimes when we're in abusive relationships, we get stuck in the negative. We get stuck in the negative. Everything's bad, everything's wrong, everything's horrible, everything's awful, it's catastrophe, blah, 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 right? So you want to start changing that narrative. You want to start changing it to something positive. So in other words, and this is a little bit of NLP coming into this as well. So in other words, instead of, oh, I have to work on myself. Oh, I have to do the self-esteem workbook. It's no. Oh, I get to work on myself. I get to do the self-esteem workbook. I get to have good self-esteem. How freaking cool is that? So that's reworking the narratives from the negative to the positive. Rewriting history, though, is like telling you that your perception is wrong. No, you always validate. So like, for example, you can validate that something horrible has happened. Absolutely. But then the question now is, now what? Okay, yes, this sucked ass. Your abuser was horrible. It was a terrible thing that you went through. I totally agree. You were completely targeted and victimized. You bet your sweet bippy. Now what? Where do we go from here? Because we can't just keep bagging on the past. We got to keep moving forward. Because you're either moving forward or you're moving backwards. There is no stuck. There's either moving forward or moving backwards. If you're stuck blaming your abuser, you're actually moving backwards. Let's move forward. Yes, they did all these horrible things to you. I validate that. You betcha. Are they terrible people? More than likely, yes. Absolutely. Now what? How do you get to move forward? How do you get to? How do you get to move forward? How do you get to live well? Because the best revenge in life is living well. Absolutely. Narcissists don't want you to do well. Malignant borderlines don't want you to do well. The negative, nasty voice inside your head doesn't want you to do well. So guess what? The best revenge is to live well. What now? How do we make that happen? How do we move forward into that reality? How do we create the best living well that you can have? That's what you want. So, okay. I hope that answered all of the questions. Okay. All right. Yes. Start working on the positive. So remember, guys, if 99 things go right and one thing goes wrong, we have a tendency to focus in on the one thing that goes wrong. Focus on the 99 things that are going right. You can absolutely acknowledge the one thing that went wrong, you betcha, but you also got to go, and all of this went right. Absolutely. I want you to start thinking positively. Okay, next week, yes, I will be hopefully having Jess Manny on. I've been trying to do this for weeks now, but we'll hopefully have Jess Manny on, and we'll be talking about how to stay healthy, happy, and whole during this whole holiday season thing. If he can't do it, then I will probably have how to start working on getting you back, because we lose ourselves. So I want to talk about how to get you back. And that will be part of it, because Jess will be talking about how to take care of your body, which I think is hugely important, because not only do we have to take care of our heads and our hearts, we have to take care of our bodies. So anyway, have a wonderful, wonderful week, guys. I love you all. Be safe, be good, be careful, and I will see you guys next Sunday. Bye.